And from then you have the CaseReasoner starting. So the CaseReasoner is interacting again with your access point, and it starts querying the system and basically sorting out the patient population. So it does some basic statistics rendering, if I can say it like this. So it takes some time to process all the data, and then it displays it graphically in the various tabs that Alexi introduced. So perhaps, Alex, you want to say a few words, or I go ahead?
Go ahead.
Okay. So that is the first tab that Alexi introduced with basic distribution of patients against a hierarchy of clinical features. Then you can ask more advanced things like looking for similarities. So you selected a patient formerly onto which you started this application, and now you can ask the system to look for similar cases. So you click on this zoom button and you have access to a list of clinical parameters that you can base your similarity search on. So here you can select a few things like I'm doing it with my limited clinical knowledge, and okay, so then you select the maximum number of patients you want the system to return, and you apply. This goes down to the patient records and populates the three visualization techniques that Alexi introduced, the three maps. So actually you see that my clinical similarity search was not relevant because they are almost all similar. So you have the three maps where each box is a patient, and the larger the box is, the more similar the patient is. And once you have identified the most similar patient, you can open his records and then compare. You have on the left here, okay, here you have the data, and you can compare. So if I take let's say patient info, you can compare one-to-one. Second technique is the neighborhood graphs. So here you see the result of your similarity search with kind of a social network. And your initial patient is the one highlighted in yellow here, in red here, sorry. And you can see the most similar one is this one from your similarity search. You also can see the overall distribution of your population like this. And then you can play it, as Alexi said, with different graphical features like clusters highlighting, like colors for different parameters.
This is filter.
Okay, I have filtered, okay. No, I didn't know that function. Okay, colors. Etc., etc. So here you can play with your population, see how it is distributed. And the last one is heat mapper, where you have a matrix of patient against patients and colors showing clusters of similarities, and then you can have new parameters against it. Alright, now I go to Radula. Okay, so this is the similarity search, where you can investigate the whole population, but you can also go down to your patient, your initial patient, and for instance ask the MR scan of your patient here. So this interacts with the access point and gets back the series of images, and then on top of that MR scan, it graphically renders the 3D meshes of left and right ventricles. So let me just select an appropriate view of this one. Okay. So here you have the ventricles and so on. You have access to different measurements that will be useful to you, like this, the right ventricle volumes and so on. And what's interesting is that all these measurements are digitalized. So now you can also ask the system to look for patients having similar shapes of the ventricle. So by clicking on this button down here, there is a process starting on the server which goes again through the whole population and looks for patients first having such records in the system, and then compares the records that it finds. So it looks for patients having similar shapes of the ventricle. So if you go back to the CaseReasoner, here you have a notification frame where you can get the status of your operation, just like you had in the patient browser in the operations tab. Okay, so once this is done, you can click on display results, and it populates the three visualization tabs, the three maps. So here you see that we have a limited number of patients having records regarding the ventricle shapes, and this is the one that has the most similar shape. You can do the same with neighborhood graph. This is your patient and the two most similar ones, and the heat mapper, which is less graphically relevant for this particular research. So all this uses the access point to investigate the whole population. It allows you to get some interesting features or measurements from your patient, but also to compare.